Everybody calls something different a dark circle. What the problem is will dictate the treatment that we have. But lines in that area and that crepey skin texture can be improved with one or both of those treatments. So don't believe any doctor on TikTok that says use this eye serum if you have all these issues. It's just not going to work. Hi everyone, Prem Tripathi, facial plastic surgeon in the Bay Area. I specialize in all things surgical and non-surgical for the face. So let's get into something that probably frustrates you that there is no one good solution for, or is there? Under eye dark circles. I want to walk you through the entire thing, what they are, what's used to treat them, how to treat them at home, how to treat them in the office, and how there are new things now that will blow your mind away with how we treat under eye dark circles. So the first thing is I want you to open your horizons on dark circles. Everybody calls something different a dark circles. I got to get to the root of the problem, which can be difficult. I think it really exists in four sort of different ways. One is hollowing, and when you have hollowing, any shadow underneath there is going to make it look darker. The second is actual pigmentation. So for anybody that has color in their skin like myself, I have darkening there that is just genetic and very difficult to fix. The third is a bag. If you have eyelid bags, like fat bags in that area, you might think that that's a dark circle and go out and buy a dark circle cream and it's not going to do anything for you. And the last is crepey under eyelid skin. Most people are not really calling that under eye circles, but it is an under eye issue that affects people. So the first and most important thing is for whoever you see to tell you exactly what the problem is, because what the problem is will dictate the treatment that we have. So first things first, what should you be doing at home if you have dark circles? Because believe it or not, there are treatments you can do at home. And this first one has actually made my dark circles better than if I had never done it at all. And that's sunscreen. Wear your sunscreen around your eyes. And the second is if you are not using your skincare products like vitamin C and retinoids around your eyes, I would start doing that. And the last is if you want, or your eyes are sensitive, you can use a dedicated eye cream. Remember, some eye creams are not actually that great. They're just nicer and a little bit more formulated to use around the eye in terms of sensitivity. But if you're not super sensitive in that area, you can use your other products around the eye. But the sunscreen and retinoids, I really think you should just be definitely using them around the eyes. So that's how you can start getting your eyes and your skin around there very healthy. But if you have an issue like hollowing or pigmentation, you will find that these are difficult to treat at home solely with skincare. Should you be wearing sunscreen? Absolutely. Is that going to fix hollowing? Not so much. So hollowing, what do we do for hollowing? Hollowing has to do with a couple of things. Lack of volume right across this bone right here, and skin laxity in that area, and separation of fat pads. When that happens, you're really looking at skin and muscle up against bone, and without volume or something bright like fat to bolster that area. So it can make you look just tired and just overall dark around your eyes when your eyes should be that bright. A treatment that can make that area look really, really nice, and believe it or not, you might hate me after this, is filler. Now, I know people are scared of filler. It's not the best thing in the world. It can migrate, but when you're adding volume to a hollow area, it's going to look better because shadows now are not cast in that deep crevice. If you don't want to do filler, you have the option to do a fat transfer. Fat we take from the body, we add it into that area. It can be added to other places. And fat, when bolstered with growth factors, is yellow, and yellow fat can make dark areas look brighter. So that can be done in the office. The next thing is not fat, but PRF Easy Gel. That is blood that we take from you. It's also yellow. It can be used under the eyes. It takes several sessions, but it can also make it look brighter, and more on that later when we talk about pigmentation. But these are things that have to eventually fill in some of the hollow and help with that dark circle under that area. Let's get into the most difficult one to treat. That is genetic pigmentation in the under eye area. You may have tried hydroquinone, you may have tried retinoids, and you still have darkening in that area. And that's because you have staining of pigment under your eyes. It is just genetic. It is what you have. It is what you will always have to some degree, unless you maybe tattoo foundation under the eyes, which I don't recommend you do. The thing that I have found that creates the best possible result in that area is a combination of lasers and growth factors combined together in that area. And when I say growth factor combinations, I mean a combination of PRF Easy Gel, exosomes, and Regenerative salmon DNA. Those are injected in different planes, all on the same day, but in different areas around the eye. And those have been shown to improve the integrity of the skin, improve the quality of the skin, and improve discoloration, which is the main issue with that staining pigmentation. I still will add a light laser just to freshen the skin, build some collagen, and help smooth that area out. It may not directly help with pigmentation, but I do think it is a nice add-on when you're already doing these injectable treatments for that area. The third is the easiest to treat, but the one that people don't really want to do, and that's when you have bags. If you have under eye bags, no cream will help, except Peter Thomas, this is unsponsored, except the Peter Thomas Roth Instant Firm X Eye temporary eye serum that will flatten the bag temporarily. There's no eye serum that's going to help bags. That is an anatomic issue. Those bags need to be surgically removed or surgically repositioned into the cheek, down into that hollow area. So that is a surgery that I do where we go in from the inside pink part of the eye, loosen up the fat, move it down into the cheek, then take fat and from your body and smooth it into that area. I also will laser that area and remove skin. It is complicated. Will it give you a permanent result? Absolutely. Will you potentially need surgery in the future? Maybe. You'll continue to age. I can't stop that from happening, but it is a solution and it will get rid of having to worry about eye creams, having to worry about foundation, and it is a solution for the problem. But of course, it's surgery, it has risks, it's expensive, so you do have to consider that. But I wouldn't waste your money on the eye cream for that one. The last and maybe potentially somewhat easy to do in the office is crepiness. If you have under eye crepiness, there's 2 procedures that can work well, but remember you have to go into with the right expectation. Your eyes are never going to be completely smooth. You're going to have some lines there. The first is high powered laser. If you are a lighter skin type, we call them Fitzpatrick 1, 2, and sometimes 3. You can use a high powered laser to smooth that skin out. And if not, we can still use some kind of laser, but you can pair it with a skin pinch where we actually remove skin in that area. Remember, you'll still have lines. I can't get rid of all of them, but lines in that area and that crepey skin texture can be improved with one or both of those treatments. So to recap, under eyes are difficult to treat because the anatomy is a difficult thing. And eye serums, while they're helpful, and sunscreen, while it's incredibly helpful, is not going to treat a major issue if you have something like bags or hollowing. These require other types of procedures. I want you to see that when you're looking at the back of a bottle that says eye treatment or eye serum. I want you to go in with the right expectation. It might help more for pigmentation. It's probably going to do very little for things like hollowing. So don't believe any doctor on TikTok that says use this eye serum if you have all these issues. It's just not going to work. If you like this type of content, like, subscribe, follow for more. I'll see you next time.